Good morning, everyone. Rainy weather has gone away and clear weather is welcoming us. Thank you for attending the Dementia Symposium commemorating the G7 Health Ministers meeting in Nagasaki. I am Kosuke Wada, Counselor for Dementia Policy Planning at Ministry of Health, Labor and Welfare, Japan. Today, we'd like to focus on the importance of building an inclusive society, achieving innovation, and encouraging international collaboration to promote dementia policies. To start the symposium, His Excellency Kato Katsunobu, Japanese Health Minister, will give the opening remarks. Please.
Thank you. Good morning, ladies and gentlemen. I'm Kato Katsunobu, the Minister, and we are grateful for your kind attendance from all over the world at the Dementia Symposium commemorating the G7 Health Ministers meeting in Nagasaki collaboration in international community for advancing dementia measures in the new era. In 2013, the G8 Dementia Summit was held in the United Kingdom. As this year marks the 10th anniversary, we are delighted to hold a symposium here in Japan. In the 2013 summit, the declaration and the joint statement included that the international community would collaborate in its response to dementia. And since then, the past decade saw such cooperation in formulating national strategies and measures on dementia. As a country that has seen the fastest pace of aging in the world, Japan devised a new Orange Plan in 2015, which was succeeded by National Framework for Promotion of Dementia Policies, under which inclusion and risk reduction are promoted as part of the comprehensive dementia measures by the whole of the government. As other countries in the world are going to experience aging, as a forerunner in aging, what we would like to communicate from Japan is as follows. Anyone could develop dementia. Importantly, our goal is to build a society where people with dementia can go on living life to the fullest in their own way with hope. To that end, it is essential to think from the perspectives of those with dementia or their families. For us to live together in the society with or without dementia, importantly, we need to listen to the voices of those with dementia and their families, stand by their side, discuss together the direction of policies and make decisions. Those with dementia, the families, stakeholders in the business, academia, and government must share one another's perspective and actions that must be taken. We launched a public-private collaborative organization for dementia in Japan. The both sectors are working in an integrated manner to create a society that is kind to dementia. We have seen progress in creating a society with public-private partnerships such as Dementia Barrier-Free Declaration, compiling guidebook by industry type, and developing services with the participation of people with dementia. In addition, we are working to foster dementia supporters who support people with dementia and their families in the community and the workplace with the right knowledge and understanding of dementia. Currently, about 15 million people took the training, contributing to the community that's kind to the elderly with dementia. I am one of the dementia supporters. By advancing these efforts, we believe it will be a pathway to eliminate biases against dementia, creating an inclusive society. Based on the National Framework for Promotion of Dementia Policies, in addition to building an inclusive society, we are also developing treatment methodologies for dementia and promoting R&D. From Japan, there has been a progress in developing a disease-modifying therapies for Alzheimer's disease. Lewy body dementia was discovered in Japan by Professor Kosaka Kenji, Professor Emeritus of Yokohama City University, who passed away the 16th of March this year. We also need to work on developing treatment methodologies, diagnostics, such as biomarkers, as well as promoting R&D for other forms of dementia besides Alzheimer's. I think the direction of the dementia measures in a new era is to promote a comprehensive package of policies in its entirety, including promoting dementia awareness, supporting people with dementia to express themselves, prevention, medical services, barrier-free promotion, supporting participation in the society, research and development, and international deployment. In today's symposium, international collaborative organizations, a group of people with dementia, and researchers are all represented with you. We will deepen our discussions, which I hope will contribute to the realization of a society all over the world where people can continue to live their life to their fullest in their own way if they develop dementia. And with this, I'd like to close my opening remarks. Thank you.
Thank you very much, Minister Kato. Now, we would like to move on to special remarks from G7 health ministers. First, Secretary of State for Health and Social Care, United Kingdom, His Excellency Steve Barclay, please.
Thank you. And first, I would like to thank the Japanese presidency for holding this important event and for inviting me to speak. With growing aging populations, we all know that dementia is a shared challenge across the G7, and I commend Japan for their continued leadership and collaboration on this important issue. The UK and Japan share a keen interest in dementia, and I was delighted that ministers in my department were able to collaborate earlier this year with Japanese colleagues to further build this relationship and discuss global collaboration in dementia research. And indeed, it builds on a decade of work together going back to the 2013 G8 communiqué and indeed Japan's new Orange Plan. And I'm sure you are all here today because you join me and others in our collective desire to build a world where every person with dementia, as well as their families and carers, receive the high-quality, compassionate care for diagnosis through to end of life that they all deserve. Furthermore, we also want to see a world where there is less fear, stigma, and discrimination, and more understanding of dementia. So I stand behind the G7's commitment in the communiqué this year, encouraging member states to develop and implement strategies and action plans, adopting integrated approaches on dementia in line with the WHO's Global Action Plan on Dementia. And the UK government is strongly committed to supporting research into dementia and neurodegeneration, and we continue to play a significant role in global efforts to find treatments. We are also making good progress with positive news on treatments for Alzheimer's disease and motor neuron disease over the last few months, thanks to global research efforts. Within the UK, we have committed to double spending on dementia research to 160 million per year and to invest at least 50 million in motor neuron disease research. And indeed, in August last year, the then Prime Minister publicly launched the Dame Barbara Windsor Dementia Mission, along with £95 million of government funding to accelerate the development of new treatments. The Neurodegeneration Initiative is a key part of this mission, and it will create a globally unique entity that will develop and apply innovations in biomarkers, data and digital science to realise a new era for precision neuroscience. And we will also create a trial network to speed delivery of early phase trials in dementia and neurodegeneration. As well as conducting world-leading research into neurodegenerative diseases, the UK is leading and contributing to several international initiatives, including the joint programme in neurodegenerative disease. And indeed, we welcome international collaboration and we want to build on those existing opportunities, such as the International Science Partnership and the UK-Japan research collaboration in neuroscience, neurodegeneration and dementia. Now, there are many examples of researchers collaborating internationally to make breakthroughs, and I know those of you here today will share in my desire to encourage this further. Just one example on an issue I'm very committed to is a project we are funding in collaboration with Japan, which will examine synopsis in post-mortem motor neuron disease and frontotemporal dementia tissue samples. And this project, like many others, will help us to better understand the underlying causes of these diseases and possible treatment targets. The UK will continue to work closely with our G7 partners on dementia research and innovation. If we are to develop new treatments and provide better dementia care, then indeed international collaboration is crucial. So thank you again for inviting me to speak, and to Japan and Minister Kato for their leadership on this very important topic.
Thank you very much. Second, Minister of Health, Canada, Jean-Yves Duclos, please.
Thank you, Minister Kato, distinguished participants, delegates. It's also my honor and pleasure to be in your company today to provide special remarks at this symposium. Merci de me donner la chance d'être parmi vous aujourd'hui pour traiter d'un enjeu qui nous concerne et qui nous affecte tous et toutes. I would like to thank Japan for hosting this symposium too, along with the World Dementia Council and the Health and Global Policy Institute. Dementia is a global health issue deeply impacting nations and individuals around the world, and it's important that we bring our knowledge and research together to address this public health challenge. We all recognize that addressing dementia requires the collective efforts of all sectors of our society, as well as the international community. We appreciate working with organizations such as the World Dementia Council, who has continued to keep the global health challenge of dementia on the world stage. Canada appreciates very much your ongoing efforts to expand and nurture global networks on this important public health issue. We are all seized with the importance of ensuring support for individuals affected by dementia, as well as their families, friends, and caregivers. Like many other nations, Canada's population is both aging and growing. Almost 500,000 Canadians aged 65 and older have been diagnosed with dementia as of 2019-2020. However, over the past decade, the rate of newly diagnosed cases in Canadians aged 65 and over has been decreasing. This is important to highlight because it also shows the value of dementia risk reduction and actions that we can take to increase awareness and leadership in the area. It's also why we supported the World Health Organization's Global Action Plan on the public health response to dementia, and also why our government passed legislation in 2017 requiring concerted action on addressing dementia. This led to Canada's first national dementia strategy, which was released in June 2019. Canada's national strategy has a vision of a Canada in which all people living with dementia and all their caregivers are valued and supported, quality of life is optimized, and dementia is prevented, well understood, and effectively treated. With its three national objectives of A, preventing dementia, B, advancing therapies and finding a cure, and C, improving the quality of life of people living with dementia and caregivers, Canada is committed to addressing this public global health challenge together. To support people living with dementia, we have made important investments in recent years for long-term care and home and community care, which we know is a priority for those affected by dementia. We have also supported hourly wage increases for personal support workers and related professions as we work together on how best to support recruitment and retention of those essential workers. Our Canadian Institute of Health Research also lead Canada's efforts to strengthen dementia research capacity in Canada and build on national and international efforts supported through the Brain Health and Cognitive Impairment in Aging Research Initiative. Our investments in research aim to increase the evidence base and improve treatment and outcomes for persons living with dementia and address mental health consequences for caregivers. Canada further recognizes the need to invest in healthy aging and is working with partners across the country to support seniors in their homes, in their communities, and in their care facilities. Through, for instance, the New Horizons for Seniors program, Community organizations in Canada are funded to help enhance the social inclusion for older adults, including people living with dementia, in all aspects of Canadian life, such as volunteering, mentoring, and social participation activities. In conclusion, we know that there are daunting challenges ahead as we work towards effective treatments, reducing the risk of dementia, reducing stigmatization, reducing stigmas, and improving quality of life for those affected by dementia. Working together, we can help strengthen brain health, create and support dementia-inclusive communities, and advance work towards safe and effective treatments and a cure. Thank you again for giving me this opportunity to speak this morning.
Thank you very much. Please give ministers a round of applause. So, the ministers are going to the main body meeting, so please move seat for some attendees. Thank you very much, and give them applause again. So please move seat for some of attendees. Also, press crews are allowed to go to the designated room. Thank you. Other attendees are allowed to hear the panel session at your seat. Thank you. So a short break, please. Okay, thank you very much for cooperating. Now, we would like to move on to the address from JDWG, AAJ, and Nagasaki Prefecture Kibo Daishi. First, Ms. Kazuko Fujita, Chairman of Japan Dementia Working Group. Please.
Good morning. I'm Fujita Kazuko, CEO of Japan Dementia Working Group. Thank you very much for giving me this valuable opportunity. It has been 16 years since I was diagnosed with Alzheimer's disease at the age of 45. During this period, the activities of people with dementia have expanded, and more than 50 dementia Hope ambassadors have been born nationwide. More and more people are working together to change the social environment for the better. We have come to realize that by changing the social environment, people with dementia, whether living at home or in an institution, in early stages or in a severe state, they can live happily, and the vitality of society as a whole can be enhanced. I'd like to communicate 3 points to you which I have experienced through my activities with my colleagues. Number one is that even after a person has dementia, this person has a potential to live with dignity and hope in this person's own way. An increasing number of people are expanding their potential by facing up to themselves with dementia, making various efforts, and continuing to create their lives. Number two, people with dementia living their own lives with hope will change the image of aging and dementia in a positive way for a wide range of people. We will be able to go out with our friends, continue our hobbies and sports, and continue working as we have done in the past. As more and more people are able to experience such scenes, they will be able to think more concretely about inclusion, living together in harmony with others, and this will help to revitalize local communities and industries. Number three, in order to build and sustain an inclusive society, it is essential for us to participate in the planning, implementation, and evaluation of policies, and to create together with others. In Japan, the number of situations in which we ourselves participate in the policy makings of a government and local governments is increasing. So I have been proposing these 3 points and implementing this with my colleagues.
in the Japan Dementia Working Group, which was established in 2014. Although medical care and technology are advancing, there is still a situation where people with dementia and their families are hesitant to receive medical examination and make use of these technologies. In order to fully utilize the power of medical care industry, I'm convinced that it is essential to create a social environment in which people can live without losing hope, even after suffering from dementia. I hope that the number of people with dementia who do not give up on their lives and live their lives as they wish will steadily increase in every country in the world. With this hope in mind, the members of a working group have gathered their voices together to introduce the Declaration of Hope for Living with Dementia, which was announced in 2018. It says, number 1, we will break out of our shell of common sense and look forward to living with dementia. Number 2, we will make the most of our abilities, continue to live a life we want to cherish, and enjoy and take on challenges as a member of society. 3, we will meet and connect with each other and live energetically with the power to live. Number 4, we will find people in our neighborhoods who will be our allies and walk with us as we share our thoughts and hopes. 5, we will work together to make our community a comfortable place to live by making use of our experience and innovations in living with dementia. We will continue to work with the Japanese government, private sector, government, industry, academia, and a diverse range of people to promote the relay of hope, to spread the Declaration of Hope. The process of creating inclusive society for people with dementia also opens up the possibility of creating an inclusive society with people from multiple generations and cultures. Let us work together to expand the relay of hope in our country and around the world so that more people can live their own lives richly with dementia, and the circle of people who want to create a better society will expand. I hope that this relay will be expanded in your countries and in the world. Thank you very much for your kind attention.
Second, Mr. Morio Suzuki, President, Alzheimer's Association, Japan.
Good morning, ladies and gentlemen. I'm Suzuki Morio, President of Alzheimer's Association, Japan. I would like to thank the Ministry of Health and Welfare and Labour for planning and organizing this Dementia Symposium commemorating the G7 Health Ministers meeting in Nagasaki, as well as Health and Global Policy Institute and the World Dementia Council. I'm also delighted to see those of you who have been working hard to improve lives of people with dementia and caregivers, namely Paola Barbarino, CEO of Alzheimer's Disease International, Joanne Pike, CEO of US Alzheimer's Association, Fiona Carragher, Executive Director of Research and Influencing, the UK Alzheimer's Society, and all of the guests from the world. Our Association of Families was established in Kyoto, and we've been promoting peer support activities for people with dementia and their families to help one another, as well as working to realize a society where people can live with peace of mind if they develop dementia. And it's been more than 40 years since the establishment. While people's awareness of dementia and people with dementia are changing, still, out of the bias and preconceived notions such as developing dementia means I'll understand nothing, or developing dementia means the end of my life. And quite a number of people feel that it's difficult to tell others that they have developed dementia. To change the situation, the government of Japan formulated in 2019 the National Framework for Promotion of Dementia Policies to realize a society where people with dementia to live their life to the fullest in their community by promoting dementia-related measures even more comprehensively and systematically. In addition, super-parties and discussions are ongoing to legislate a basic law on dementia to promote an inclusive society. And I am having high expectations on the outcome. Looking at the world, the Global Action Plan on the Public Health Response to Dementia 2017 to 2025 was unanimously adopted by 194 members of the WHO to strengthen measures to respond to dementia. But it's only about 20% of the members who formulated the national plan like Japan did. ADI is requesting to extend this action plan period by 4 years to 2029 so that more countries can devise the national plans. I would like to ask the Japanese government to express your strong support for this 4-year extension at the World Health Assembly, which will be held soon. In the National Framework for Promotion of Dementia Policies, it says, sharing Japan's experience as a country that has plunged into an aging society at the fastest pace with the rest of the world and promote international exchange. Various countries in the world are paying attention to what is happening here in Japan as an advanced aging society, as well as the implementation of business, academia, government, collaborative work and research. I hope Japan will continue to exert international leadership to solve various issues related to dementia, which is a global health issue. Thank you.
Third, Mr. Yutaka Tanaka, Kibo Taishi of Nagasaki Prefecture, please.
Hello, my name is Tanaka Yutaka. I was born here in Nagasaki. I'm now 54 years old. 4 years ago, I started to make mistakes in my work at the company. I wondered why I cannot remember so much. And I was worried that I may have dementia. I was recommended by my superior, and I decided to see a doctor. While I was waiting, I was worried of the future of my children. If I'm diagnosed as having diagnosis not only my family, but I will cause trouble to the company and others around me. I was so worried and was praying that this must be a mistake. When the doctor told me that I have dementia, my head went blank. After that, I was thinking only negatively and got depressed. But I thought I can't just stay depressed when I think about my children's future. I have no choice but to look for what I can do now, and I decided to think positively about everything. And after almost a year and a half, I was able to accept my situation. I was worried that people might look at me in a discriminatory way because of an old image of dementia. However, I told my family and others involved in my life because I thought it would be easier for them to deal with me if they knew about my condition. After I told them, my family, the community association, and my workplace began to understand me. I was able to connect with the staff of a regional comprehensive support center and other organizations because I did not hide the fact that I had dementia. On the other hand, because people with early onset dementia on the surface look healthy, so some people do not understand my illness and sometimes felt mentally depressed because of the terrible things they told me. In addition, I have been taking more and more time off work due to my poor health, and my income has become unstable. I wanted to continue working until my children graduated from high school, but I was not sure how long I would be able to continue. In the course of my activities to promote awareness of dementia, I felt that there are situations in which people with dementia and their families are reluctant to talk about it with others. So I started the Orange Talking Group in the hope that we can dispel this image and make it easier for people with dementia to live in the community if they communicate with others and have a place where they can connect with other people with dementia. I want to continue my activities as an ambassador of hope for my hometown of Nagasaki, as well as for those who are suffering from dementia and those who will develop dementia in the future. Thank you very much for your kind attention.
Thank you very much. These voices are the crucial key to the future. Thank you again. Now, we would like to move on to the panel discussion 1. Panel discussion 1, inclusion, will now commence. The chair of this session is Professor Kenji Toba, CEO, Tokyo Metropolitan Geriatric Hospital and Institute of Gerontology. Time management will be important from here. Please cooperate with timekeeping. One bell 30 seconds before, and another bell on the hour will start. Okay, now I would like to pass the facilitation to Professor Toba, please.
Good morning. My name is Ken Toba, working for Tokyo Metropolitan Institute for Geriatrics and Gerontology. I am a geriatrician treating persons with dementia. I'm very honored and delighted to chair the symposium commemorate with the Health and Welfare Ministerial meeting in Nagasaki. As all of attendants know, the cognitive decline in senior citizens is a global issue. Japan is one of the most rapidly increasing countries of cognitive decline in older people. In 2019, we have announced new dementia measure with 2 core pillars. One is social inclusion and well-being of senior citizens with cognitive decline. Second issue is risk reduction and medical care with developing adequate biomarker and disease-modifying drugs. 2 pillars should be cooperated and integrated by understanding of all people. In the first session, we have distinguished guest speakers who are vigorously dedicated to promote social inclusion and well-being by educational and science-based approaches. I'm very sorry for each presentation is limited only for 5 minutes. Please show us the essence of recent activity. First speaker is Paola Bernardino, CEO of ADI. Please start the presentation.
Thank you very much. Next slide, please. Thank you to the Minister of Health Japan for inviting Alzheimer's Disease International to speak. Dementia is a growing public health crisis. In 2019, over 55 million people worldwide were estimated to be living with dementia, a figure set to increase to over 139 million by 2050. Yet, despite almost as many people living with dementia as the population of Italy, the discrimination and stigma surrounding dementia remains rife. In 2019, ADI highlighted in our World Alzheimer's report that over 62% of healthcare practitioners wrongly believed that dementia was a normal part of aging. This belief, alongside general apathy from governments and society, means that 75% of people living with dementia globally remain undiagnosed. Accordingly, we estimate that 85% of those living with dementia globally do not receive post-diagnostic support either. Change slide, please. While dementia is not a part of normal aging, age is the greatest risk factor for developing the condition, and by 2050, over 2.1 billion people will be over 60. It is clear that as societies are aging, we can no longer delay or ignore this growing crisis. Concerningly, dementia is now the 7th leading cause of death worldwide and within the top 3 leading causes of death in most G7 countries. Next slide, please. Japan has been a world leader with its approach to aging societies, which has led to major innovations to healthcare systems and labor. One such early initiative was through the development of dementia-friendly care homes and societies. Many G7 countries and beyond have embraced this initiative, which we now describe as dementia inclusivity. The Dementia Friends program, spearheaded by Japan and the UK, has resulted in over 11 million people being trained to support those living with the condition in Japan alone, allowing them to continue living fulfilling, independent and enriching lives. Change slide, please. And collectively helping to reduce the annual estimated $1.3 trillion cost of dementia, a figure projected to rise to $2.8 trillion by 2030. Next slide, please. While progress has undoubtedly been made, it is important that G7 members demonstrate leadership and are at the forefront of the current challenges which are beset upon those living with dementia. Employment law remains a key area where policy leadership is required. Carers must be supported to remain in work through focusing on adaptations to the workplace and reappraise existing labour laws. Taking examples from existing innovation that exists around the child care model and the ability for multiple family members with flexible employment to share a caring role. Advances in diagnostic mean that those living with dementia who do receive a diagnosis are being diagnosed earlier, increasingly in the 40s and 50s, as we have heard from the previous speakers. Accordingly, it is fundamental that we look at new and innovative ways to ensure that those living with dementia remain in employment for as long as they are able to or feel comfortable doing so. This cannot be achieved by solely creating specific jobs for those living with dementia. We must also plan for the future, ensuring that health and long-term care systems are able to provide support for those living with dementia. To achieve this goal, long-term care must be better funded and resourced and provide more care at home and in the community. Increasingly, a shortage of paid and professional carers is threatening the sustainability of existing long-term care mechanisms. Some G7 nations are developing bilateral agreements to ameliorate shortages in care staff. G7 member states should be cognizant of the impact that this has on care provision in other countries and must show leadership to ensure that professional care is available to all. Next slide, please. Dementia-inclusive societies must place a greater focus on research. Far too often, LMIC and minority groups, including ethnic, indigenous, and LGBTQIA+, are forgotten. We can only create a dementia-inclusive society if we are truly inclusive of all those who encompass it. More research must be conducted on how local and community healthcare can take a more proactive step in providing care at home, with the aim of reducing the reliance on hospital care. Furthermore, increasingly, numbers of people living with dementia are doing so alone, and more must be done to support those in those vulnerable situations. We now find ourselves in a world where disease-modifying treatment for Alzheimer's disease are no longer a dream, but becoming a reality. With each new positive development in disease-modifying and symptomatic treatments come a greater risk that we expand the void of inequality and accessibility. While there are many things that we as a community can do, it is only governments who can truly address this inequality. Finally, with new treatments come an immense responsibility and duty to ensure that they are priced sustainably and compassionately. Recent research in Sweden suggests that if lecanemab was sold at list price, it would consume 80% of the current budget allocated to all prescription medication. This is clearly unsustainable. Accordingly, I call on each and every one of you to ensure that dementia-inclusive society are not a buzz phrase, but a series of principles that we manifest in our actions to truly improve the lives of those living with dementia and carers across the world. Thank you. Phew.
Now, our presentation is open for the short question and comment. Any comment or question? So, from me, one question. So, you mentioned about some law, the working law, need to go to the second step to the inclusive society. How about the current situation of such a job law in Europe?
Well, we are having a big issue with this in many, many different areas. So the first one is that people cannot stay in work, no? So we do need better employment laws for carers. That is the biggest one. You know, a lot of governments are wondering why there is a lot of workforce that is not actually rejoining work after COVID-19. And one really has to think, are a lot of people with caring responsibility for children and for elderly people unable to take work where they could be doing that? Italy, for example, has passed the law 2 years ago about supporting carers at home. So that has been a very positive improvement. There are other nations that have got positive legislation on that. So it can be done, but also, of course, for people living with dementia. And finally, I recently returned from a long trip in Asia, and it is becoming apparent how certain nations are training healthcare professionals. There is a crisis in healthcare professionals pretty much everywhere. And those healthcare professionals, first of all, there isn't enough. They are not being trained quickly enough. And of course, as their own societies are now requiring care for people living with dementia, they are not migrating enough. And also certain legislation prevents migration. So we have a problem. We just have to sit down, and this is why I hope that G7 countries can listen to this and take a proactive approach to just do strategy together, but also in a way that does help lower income countries and poorer countries as well as wealthier countries.
Thank you. So then I move to the next speaker. Second speaker is Dr. John Pike, Alzheimer's Association. She has been CEO of Alzheimer's Association from 2021. Dr. John Pike, please.
Thank you. I want to start by saying thank you for the invitation to be here, and also for our three speakers to talk about your experience, because I think what we're talking about here in inclusion, it's incredibly important to consider your voice during this conversation. As we enter an era of dementia care with disease-modifying treatments, it's incredibly important that we have to consider how individuals living with dementia or the early stages of Alzheimer's value their needs in medical care. We also need to consider efforts of inclusion to reduce societal stigma, to support brain health and early diagnosis efforts. The Alzheimer's Association has been looking at inclusive related policies since the inception of our organization 40 years ago. However, since 2006, we have launched 2 specific initiatives that bring the individuals who are living with dementia into our programmatic support in a new and expanded way. We launched an early stage advisory group and also a series of town halls that heard from individuals and what they value. Our early stage advisory group is both national in scope and has local engagement across our country nationwide. Our early stage advisory group is composed of 12 individuals that have 1-year terms that are willing to tell their story and experience, to share what it means to them and their family with the media, and in order to generate programs and support. As part of this, we also look at the philosophy for what we need to do as an organization. How do we include their voices within the Alzheimer's Association? We look at it from a couple of different angles. Philosophically, the action that we do. How do we support research? And we have been looking at ways in order to expand their leadership. The early stage advisory group that I mentioned has 2 individuals that are included within our National Board of Directors to make sure that our leadership at the highest levels includes their voice. In addition to that, we make sure that the stories that we tell within the media from the Alzheimer's Association include their stories also. Right now, during this time when innovative treatment is spending a lot of time in our dialogue, and I'm sure we will hear more about it today, their need for diagnosis and accessibility is incredibly important to make sure that everybody hears. In addition, we look at inclusion within program development. From a public health perspective, the Alzheimer's Association supports what is called a community-based participatory model, where including experience and voice in building our care and support programs through co-creation is part of that development process. We look for feedback and participation in the design and implementation, both at the very front end, but also in the evaluation and the research feedback. In addition, a third way that we are including those living with dementia in our priorities is through our advocacy, both in public advocacy and policy advocacy. We hold, and when we worked with the other national organizations to build the National Alzheimer's Project Act in the United States, we ensured that an individual living with dementia was included on the leadership team within NAPA. We also build stakeholder groups so that as policy decisions for the United States are made, whether that is for treatments through the FDA or through Medicare, that stakeholders have the experience of being able to talk to and learn from those who are living with dementia. A fourth way that we have really designed and built inclusion is around research. Right now, we are leading a stakeholder group and working with the National Institutes on Aging to develop metrics that matter for those who are living with dementia, that are person-centered in design, and also that are funded through and utilized with the CDC and through NIA. But most importantly, in this time of treatment, as it begins to roll out globally, we have to consider what is meaningful in outcomes. We spend a lot of time talking about meaningful change. What is clinical meaningfulness? And we need to consider those who are living with dementia as part of those outcomes and the design of those outcomes. And I will end with this. One of our current early stage advisors, who's on our national board, said this last week, in today's time of innovation, do not let the pursuit of perfection in the healthcare system stop me from receiving treatment. Thank you.
Is there some question or comment from Laura?
Yes, I have one.
Please.
One for Joanne. John, what you just said at the end there, apart from all the enormous effort you're doing for inclusion, which is fantastic, is so important. So do you still perceive that that search for perfection is preventing people today to receive, to access treatment in the US?
In the US, I know that there's probably lots of individuals who have different thoughts on this one, but the US system is built off of a healthcare system that requires payments. We do not have a single payer model. And the pursuit of perfection, in a lot of ways, is stopping the infrastructure from being built in the United States because we do not have a payment model to support diagnosis and treatment in an expanded way. So right now, our number one priority as part of the Alzheimer's Association is to pursue the Centers for Medicare and Medicaid to make sure that a payment model is developed and provided for diagnostics and treatment as those innovations are approved and become available. So until that payment, until CMS changes their decision, the infrastructure, in my opinion, will not be built to support in an expanded way. Thank you.
Thank you. Any other question or comment? Okay. So it's a very great job to promote pro-scientific activity between the academic and people with dementia. So maybe it's a very good idea, especially for Professor Iwatsubo and Akiyama. Thank you. So then I move to the third speaker, Dr. Shuichi Awata. He has been chair of Integrated Research Initiative for Well-being of People with Dementia. Dr. Awata, please.
Thank you, Professor Toba, for your warm introduction. I'm honored to have the opportunity to give this presentation. So today I'd like to talk about creating an inclusive and sustainable dementia-friendly society from the recent trend of national dementia measures in Japan. Please, next slide, please. So over the past decade, the national dementia plan in Japan moved toward an inclusive and sustainable dementia-friendly society. These steps are in accord with WHO Global Action Plan on the public health response to dementia and key principles for dementia-friendly communities described in ADI's report. And next slide, please. The Orange Plan in 2012 aimed to realize community-based integrated care system to support the lives of people living with dementia and their families. These plans intended to integrate existing healthcare services such as medical centers for dementia, dementia support doctors and primary care physicians, and social services, including community general support centers and a series of long-term care insurance services. In addition, next slide, please. In addition, an initial phase intensive support team, a multidisciplinary team that coordinates services intensively at the early stage of dementia was established in every municipality to enhance this system. Next slide, please. Along with this development, the voices of people living with dementia are starting to be heard. In 2014, the Japan Dementia Working Group, or JDWG, the first organization of people living with dementia, was established. The group's representative, Ms. Kazuko Fujita, talked about her experiences using the phrase blank period as a global dementia legacy event held in Tokyo in 2014. The blank period meant that no services had been developed from the perspective of people living with dementia. Subsequently, the JDWG promoted a dementia meeting, a meeting held by people living with dementia themselves to talk about their thoughts, voice their opinions, and participate in the creation of communities. In 2018, the JDWG created a guide for people living with dementia to help people with dementia live well with hope and dignity after diagnosis. In 2020, 5 persons with dementia was appointed as ambassadors of hope to promote the communication of the voices to the public. And after which local chapters were established and expanded to several cities and prefectures. Next slide, please. In parallel with this movement, a variety of dementia-friendly initiatives emerged and contributed to the co-production of a dementia-friendly environment. Next slide, please. In addition, a public-private partnership council was established at the national level and gradually local level. Next slide, please. The Japanese population has the highest life expectancy in the world, and the prevalence rate of dementia in older population is 65 and older is steadily increasing, on track to reach 20% by 2030 and 25% by 2060. The particularly noteworthy is the remarkably increasing number of oldest old people aged 85 years and older with dementia. Next slide, please. This means the number of oldest old people aged 85 years and older living alone with dementia is rapidly increasing. Generally, these individuals have complex needs in terms of health, housing, finance, everyday life, protection for rights, and so on. In addition, we have repeatedly experienced the social isolation is amplified during the emergency situations such as disasters or pandemics. Next slide, please. So, as a response to global population aging, it is crucial to develop inclusive and sustainable dementia-friendly societies where everyone has meaningful social connections, regardless of age, sex, race, functional ability, household type, place of residence, and disaster or pandemic situation. Next slide, please. To realize this vision, we established integrated research initiative for living well with dementia at Tokyo Metropolitan Institute for Geriatric Gerontology. Thank you for your attention.
Thank you for presentation. There's some comment or question, please.
Sorry, another one. Very interesting presentation, and thank you also for the history. So important what Japan has given to the world in this respect. But can you tell us a bit more whether there are any public-private partnerships that you can talk about specifically addressing the issue of people living alone with dementia?
For example, IT technology may be a benefit for people living alone with dementia. And in Tokyo, we are now starting to study on IT technology to support the lives of older people, including people with cognitive decline and living alone. And in collaboration with our institute and some initiative in collaboration with people living with dementia.
Domo arigato.
Any other question, comment? Please.
I know Japan has adopted a risk reduction strategy, Dr. Awada. And I am curious, as you look over that long time period on one of your charts, whether the prevalence by age of dementia is going down. Is it successful, your risk reduction strategy?
It's very, very important questions. We have never sound data about this issue. And now now Professor Ninomiya in Kyushu University is studying about recent prevalence of dementia. He can compare the difference between the prevalence in 2012 and current data. But we have never seen that data, so I don't know. I don't know currently.
Yeah, some of the data show the decrease of the prevalence of dementia, especially in the moderate to advanced case. The ratio in the age-collected data is decreasing in Japan. There's maybe some effect of some risk reduction. Any other comment or question?
Thank you.
Okay, so I will move the final speaker, the Ms. Fiona Kelleher, Alzheimer's Society. She is the Executive Director of Research and Influencing Dementia Health Research, Social Care Policy, and Social Changes. Unfortunately, he cannot present in person, but he will appear online. Fiona Kelleher, please.
Hello, everybody, and thank you for the kind invitation to speak to you. And sincere apologies, I'm not with you in person. I have pre-recorded my opening remarks, so if we're able to play that film, thank you. It's a great honour to speak to you today on behalf of Alzheimer's Society, the leading dementia charity in the UK, delivering services, funding world-class research and influencing for policy change to improve the lives of people affected by dementia from this devastating disease. I'm delighted to be alongside Paola and Joanne and to have the opportunity to address you all as decision makers and policy makers, each of you able in your own way to make a difference. And the reason we are all here today is because we acknowledge dementia is a truly global challenge. And working alongside our friends and partners, learning from and challenging each other is the only way we will make the progress so desperately needed. There is an overwhelming case for change that needs to be heard by decision makers everywhere. Dementia is a high-impact disease, amongst our biggest killers, affecting healthcare systems and societies at scale. You all know that, of course. But we have a unique chance to work together to offer the help and hope to people affected by dementia wherever they live. Face challenges of research funding and participation, of diagnosis, of integration across health, community and social care, and of preparing ourselves for the potential of new treatments in the future for the first time. As our systems respond to dementia and hopefully ready themselves for disease-modifying treatments in the years ahead, I urge leaders in those systems and ministers in some of our most influential nations to walk hand in hand with a group of people facing the greatest impact of dementia, those affected by the disease themselves. There are millions of people facing the injustices in dementia for so long now without hope. But there is hope. And to turn that into reality, people affected by dementia need to be front and centre of the progress we need to make. Involving and including people affected by dementia must surely be the most credible and authoritative way of delivering the changes we need to see. After all, no other group of people know the challenges so acutely or experience them so personally. We have a duty to have them at our sides when working out how to do better so they can tell us, tell you, what it feels like to live, often confused and uncertain, often with no access to good quality support services, and often with no hope, with dementia. We have a duty to understand and represent the experiences of millions of people who so selflessly and often without proper formal or informal recognition spend years caring for loved ones with dementia. And we have a duty to provide them with the hope and support we know is possible. And with so many of our healthcare challenges, this is easier said than done. True inclusion and involvement takes time, resources, and a willingness to listen and learn. Those most impacted by the injustice and inequalities in dementia will be amongst the hardest people to reach and engage. But that should not stop us, because we know the value and impact of doing this properly. So my challenge to health systems all over the world is the same challenge to the policymakers in the UK, and it's a simple one. Work with us. We have the power and reach to convene the people who matter the most, and the expertise to do it properly. At Alzheimer's Society, for example, we have teams of people whose job it is to bring the voice of people affected by dementia to the fore and involve them meaningfully in shaping what we dearly hope is going to be a much brighter future. I started by saying that we have a unique opportunity to improve the lives of those affected by dementia. While the fear, confusion, uncertainty, and lack of support for so many people across the globe with dementia is still there, we do have hope on the horizon. And we cannot miss the chance, working alongside those who know all of this best, to do and make things better. Let's learn from each other, let's challenge each other, share what works and what doesn't, as a global team committed to one day living in a world where dementia doesn't devastate lives like it does just now. People affected by dementia deserve nothing less.
Thank you for the presentation. Is there any comment or questions? It okay? So I would like to conclude this symposium. For social inclusion for persons with dementia, we need integrated power of all stakeholders, including academia, medical and social welfare groups, and industrial companies, travel and finance and police, and also school. But also we need international collaboration to overcome especially disparity, especially the introducing a new disease-modifying drugs, etc. So thank you for listening. Thanks. So now we close this symposium.
Thank you very much, Professor Toba and the panelists. Now, we would like to move on to the panel discussion 2. Panel discussion 2, risk reduction and innovation, will now commence. The chair of this session is Dr. Haruhiko Akiyama, Japan Agency for Medical Research and Development. Now, I would like to pass the facilitation to Professor Akiyama, please.
Thank you. Good morning, ladies and gentlemen. We now start the second panel discussion, as noted. The title is Risk Reduction and Innovation. In this session, we listen to the presentations by 4 speakers. Please let me go through all presentations first, and then after that, if possible, I will have discussion time. So our first speaker is Dr. Takeshi Iwatsubo. He's a professor of University of Tokyo. He also heads National Institute of Neuroscience at National Center of Neurology and Psychiatry. He will talk about the innovations toward risk reduction and therapeutics of dementia, Japanese academic perspective. Dr. Iwatsubo, please start your talk.
Thank you very much. I'm going to talk about some personal perspectives from a Japanese academic research standpoint, and focus maybe as to how we could achieve innovations towards goal of risk reduction and then therapeutics of dementia at the worldwide level. And then I have been organized my 2 slides in a very segmented fashion, so I may have to tell click please, so please forgive me. Next slide, please. So to start with, I'd like to briefly summarize the past and the current status of dementia research in Japan. Click please. Especially with focusing on the international collaborative aspects. Click please. So back in 1980s, there emerged a couple of efforts on basic research of dementia. For example, the identification of tau protein and neurofibril tangles, and the significance of beta 42 protein amyloid formation. And click please, the formation mechanism of formation and gamma secretase complex. Click please. And in this century, in 20,000s, these research efforts were being bridged to some global clinical studies like Alzheimer's Disease Neuroimaging Initiative headed by the Alzheimer's Association in US. Click, please. And Diane, dominantly inherited Alzheimer's network on the familial Alzheimer's. And then a platform for a public-private partnership and data sharing has been established. Click, please. These efforts came to fruition as the development of innovative drugs as represented by the accelerated approval of an anti-A-beta antibody drug, lecanemab, for early Alzheimer's early this year. Click, please. And the framework of Japanese and US ND has been evolved into trial-ready cohort, which is focusing on the even earlier stage, asymptomatic stage, that is called the preclinical Alzheimer's disease. Click, please. And you may know that lecanemab is currently being tested in the secondary prevention risk reduction trial called AHEAD in a global public-private partner setting. Click, please. And then I would like to emphasize and thank that this achievement has been fostered and supported by international experts like World Dementia Council that was collaborative of those top-notch charities and non-profit organizations in this field. Click, please. Okay, so what then will be required for the future success of the dementia innovation at a worldwide level? Click, please. First, promoting the top-notch basic sciences and bridging them to the clinical innovation in the dementia field is essential. Click, please. And an acceleration of data sharing, expanding the sharing to knowledge various resources is also vital. Click, please. On the technical front, development of more effective biomarkers like amyloid imaging and markers have greatly accelerated the recent AD drug development, so that further innovation may be mandatory. Simultaneously, I have to emphasize that redoubling research efforts for non-AD dementia, like dementia with Lewy bodies, and then frontotemporal dementia also may be very, very important. Click, please. And fostering young scientists who jump into the dementia research is key to promoting and sustaining the future research. Click, please. And then encouraging public-private partnership in non-exclusive and competitive settings will remain as key drivers of promotion of dementia innovation. Click, please. And efforts to increase public and private funding for dementia research will be continued. Click, please. And establishment of a National Dementia Act like a NAPA in the United States may be mandatory. And I have to tell you that such an effort is ongoing here in Japan by a number of statesmen, statespersons. Click, please. And I'd like to stress that the inclusion of people with dementia in every step of dementia research is essential. Click, please. And then lastly, we believe all these efforts will surely pave the way towards the realization of innovation to prevent and cure dementia in the near future. Thank you very much.
Thank you, Dr. Iwatsubo. And our next speaker is Dr. Bart Strupper. He is the director of United Kingdom Dementia Research Institute at University College London. He joined in this session online from United Kingdom. I understand his video ran first. Is that right? Okay. So please start the video by Dr. Strupper. Oh, you are here. If you have some greeting, please.
Yeah, oh, thank you very much. Yes, I have a video assembled. I thought it was more safe than doing it directly. So thank you for the invitation, and please, can you start my video?
Okay, yeah, please.
So thank you very much for the invitation. My name is Bart Stroper, and I'm the director of the UK Dementia Research Institute. It's really a great time to talk about Alzheimer's disease because we have finally the first drug that treats the disease. Lecanemab, which was developed here in Japan, treats the amyloid plaques that cause the whole cascade of neurodegeneration. The problem is that this drug treats the very early beginning of this cascade, and that it takes 20 to 30 years to translate the amyloid pathology into the dementia, which we treat in the clinic. So it's a very important time now to understand what happens between this initial trigger and the final stage of the disease. We call this the cellular phase of Alzheimer's disease, where all kinds of cells in the brain participate to try to keep the brain healthy. And so it's extremely important to understand this resilience and these homeostatic mechanisms to develop new medication. The importance of basic research cannot be overstressed. Here you see that discovery research is important to get translation and clinical research going. Most of the investments at this moment in the field are in translation and clinical research. But we need this discovery research because this gives us the insight in the molecules, the pathways, the systems, the mechanistic biology, the human biology, and it's very important also the data science, which bring all the knowledge together. I can try to explain this in a different way. In this figure, you see the axis of the quest for fundamental understanding, which characterizes research, but also the axis which characterizes the quest for applications. And if you use these two axes, you can divide the research landscape in 4 quadrants. And so here at the top left, you see the pure basic research, the Bohr quadrant, which only strives to deeper knowledge. This is where the fundamental knowledge coming from and where the Nobel Prize winners are generated. The other quadrant here is that one of the pure applied research, the Edison quadrant. That's where we have good ideas, where we have a lot of knowledge, and where we can really plan how to move forward, for instance, towards a therapy. And then you have here the Pasteur quadrant, where we need still a lot of basic research, where we use basically the basic research from the Bohr quadrant, but with the goal to understand something, in our case, Alzheimer's research. And this is the quadrant that needs much more investment, because the ideas from this quadrant will be moved then to the Edison quadrant. And this pipeline is not filled enough. That what I'm saying is true is proven by these numbers here. So you see here that in dementia research, there are about 264,000 papers in the database, in the PubMed database. This is not bad, but if you compare it with cancer, there are 4,800,000 publications. And it's even more dramatic if you think about the fact that there are more people with dementia in the world than people with cancer. So we know 20 times more about cancer than about dementia. So if people ask me, why do you have treatments for cancer and not for dementia, I think the answer is clear. There is an underinvestment in the study of those disorders. It's not only dementia, but also other neurodegenerative disorders which have been not sufficiently investigated. So Alzheimer's has about 200,000 papers, and the other dementias and neurodegenerative disorders have even less. If you compare that to other areas of medical research like cardiovascular disease or diabetes, you see that there are 2,100,000 papers for heart and vascular disease, while for diabetes we have almost 1 million publications. It's very dramatic when you compare it with COVID, where we have 350,000 papers. Although the research in that area started only 4 or 5 years ago. We know basically more about COVID than about Alzheimer's. Despite that we have been slow and that we have been underfunded, there is a tremendous progress made in the field of neurodegeneration. We have now small molecules, gene therapy, oligonucleotides, antibodies and nanobodies, cell therapy, deep brain stimulation, brain-supporting devices, and technologies to support people. And so what we basically need is now a big jump to bring all these things to the patients and to cure finally neurodegeneration and dementia. What's needed is trust and empowerment of the science and scientists, and we need to see much more investment in this area and in this field. But there is good news. 10 years ago, the United Kingdom announced that they were going to do that they were going to take a big initiative in the area of dementia. And they launched thereafter the UK Dementia Research Institute. And now we are on the ground, working very hard together with many other initiatives and partners in the dementia field to find cures for these disorders. And so what I hope is that we see in the next years many of the similar initiatives all over the world. And here you see the people we join up into the UK Dementia Research Institute to fight these terrible disorders. And we say hello to you and encourage you to take initiatives. Thank you very much for your attention, and I'm happy to take questions.
Thank you, Dr. Stulpa. The next speaker is Dr. Philip Sheltens. He's the director of the Alzheimer's Center at Amsterdam University Medical Center. He's a member of the World Dementia Council. Dr. Sheltens, please start your talk.
Thank you very much, Mr. Chairman, and thanks also to the Japanese government for hosting this important conference. As the chair of the World Dementia Council, I have the pleasure also, on behalf of my director, Lenny Shellcross, also present, to report you what we have done in March 20. We had a summit and we had panel discussions on many of the topics that actually are really relevant for today. So I will take you through some of the elements that we discussed. Next slide. So again, it has been remembered, it's 10 years on, and it's especially refreshing to look back at what the G8 actually formulated in 2013. And it's also good to note that some of the the provisions that they made actually came through. So a cure before 2025, it's probably actually happening. So things have been moving on, but we are not there yet, as we heard today. So many things have to be done still. And it's good that we are here today to discuss this with the G7. Next. So first of all, and it has been mentioned also, the patient perspective, how important is that? And you have voiced this also today. It's about diagnosis, it's also about treatments. So if you look at the world, the diagnosis is really uneven. There are countries where people are diagnosed very easily and countries where no diagnoses are being made. Even within countries there are differences. Usually it's still at the specialist level, but when we see the increasing prevalence, we will not have enough specialists to take care of this. So this has to be done also in the primary care level, and primary care physicians have to be educated and have to get ready for that. We are not very good in making a prognosis, so making the difference between patients who will decline fast versus not is actually not possible today, so we need markers for that as well. And to really be honest, and Fiona also said this, we are still making a diagnosis relatively late in the disease trajectory. And for the treatments that we are coming to see now, we need this diagnosis much earlier. So treatments, it has been mentioned, we didn't have any treatment for more than 100 years. We now have at least treatments that are granted by the US FDA, accelerated approval. The third one has to come, and we had very positive results by Lilly just a month ago. So hopefully this will also happen, but not yet in the rest of the world. What will the EMA do? What will Japan and China do? And reimbursement has also been addressed by Joanne, is crucial. And there's also huge differences within the world about how reimbursed and how these treatments will be reimbursed. So this is, of course, just the very beginning. We need many more drugs in the pipeline, and that's why it's important what Bart also called for. Much more research has to be done. Next. One crucial element, I think, that has changed the future also is that we have biomarkers. We have imaging biomarkers, we have biofluid biomarkers, especially for Alzheimer's disease, but not yet for the other diseases. So we have to work very hard to get these biomarkers also for other diseases within the neurodegenerative spectrum. And it's also important that these biomarkers are being used not only in the specialist setting, but also in the primary care setting, where they can actually make the difference between sending patients for further evaluation or not. So the portfolio of biomarkers need to be expanded. Next. We have to have a portfolio of biomarkers. We don't have the real sort of perfect biomarkers. We are getting with the plasma biomarkers, of course, next to the next level and also in the GP setting. Digital biomarkers are probably very sort of suitable for detecting very early signs of disease, for instance, gait, speech, browsing on your Google sort of browser. That sort of tracking can be done by AI technology, and that's probably very much easier to do also globally and not in a specialist practice. Imaging has to be done because in terms of the treatment that we will have now, but it's still very expensive, and not every country has good coverage of all these imaging facilities. So we need to work there hard as well. Next. So the challenge, and this was very nice voiced in an editorial in Lancet just yesterday or the day before, treatment for Alzheimer's disease, time to get ready, and time to get ready for everybody. So the community has to get ready. We have to get used that we are doing cognitive assessments on a very low and sort of basic scale, probably also using AI technologies. So digital will be the new normal. The funders and regulators have to be an open mind to innovation, and of course spending more on innovation and spending more on research, which is a given. And we have to think out of the box, and we have to also force to share data across the world, actually open access for everybody, and for governments in general, the G7 especially, time to get ready. Thank you very much.
Thank you, Dr. Schultens. And the next speaker is Mr. George Vredenberg. He's the founding chairman of the Davos Alzheimer Collaborative. And he's also a member of World Dementia Council. Mr. Vredenberg, please start your presentation.
Well, thank you very much to the Japanese government, and a specific call out to Wada-san for all of his work in organizing this effort, and to my fellow warriors, Kiyoshi Kirikawa and Ryoji Nirataka, and of course my boss, Philip Sheltons. So I deeply appreciate your pulling this effort together. I'm a businessman. I came out of the media, entertainment, and internet businesses, but now I'm a philanthropist. And now I am working full-time in this space, unpaid, of course. But I have a family that has 3 generations of people who've died of this disease. A grandmother, a mother, and a brother. And that's over a 45-year period. And right now, we can't say we yet have a drug on market that will change that for my children and my grandchildren. So I am in this to win it. I think this is a matter of innovation. I cannot imagine a world in which we do not take on Alzheimer's just like we've taken on cancer. And we're about 20 to 30 years behind them. But we've got to pick up our pace. And innovation, at least for my business, is where this is at. Next slide. This is obviously things that we've heard before. I will just mention that the $1.3 trillion of annual social and economic cost of this disease is an annual number that's doubling every decade. So if one looks simply at the 2020 to 2030 period, it is a $15 trillion problem for the world. If one looks at from 2030 to 2040, it is a $25 trillion problem. In business, if you had a problem that was $25 trillion and you were spending what we're spending in this world today in research to get an answer to that problem, you'd be fired. We have inadequate support, as Bart has made clear, in terms of investment in this effort. The other thing that's quite clear, that no one sector can solve this alone. Government can't do this alone. Researchers can't do it alone. Business can't do it alone. Quite frankly, patients would like every single one of the researchers in this space to get a Nobel Prize. We don't care who gets it. We want everyone to get it. We don't care which company has the IP that gets the cure. We'd like to have 10 companies, 20 companies with a cure. So we don't care who wins this game. We want patients to win. We have to do this globally because this is not a disease of one country. Next slide. I'm going to talk about 3 different strategies that I think are important. This is a METI slide that was delivered at the Lausanne conference, which is our conference conducted every year, 9 years since the G8 conference in 2013. They presented this 4 years ago, in which they showed that the way that we are dealing with health in the 21st century, given the longevity of populations, is that most of the diseases are going to be, or most of the health systems customers are going to be over 65. Now, it's a problem because you can't treat your way out of this. You can't carry your way out of this. You've got to find a way, as Bart was laying out and as Philip just emphasized, to go earlier in the course of the disease and prevent symptomatic disease. Go into that period, which is pre-symptomatic, and do that. And we have to do it at much, much lower cost and a much broader set of innovative detection and diagnostic techniques than we have today. So this is going to take innovation. And ultimately, I hope it was within the next 5 to 10 years, we would aim at an Alzheimer's vaccine. We've just started a working group with 7 companies who have Alzheimer's vaccines in preclinical or clinical development, including one of the major pharmas. And other major pharmas are now beginning to look at this. The critical scientific challenges of doing that. There are regulatory challenges of whether or not our regulatory systems are up to actually doing clinical trials in Alzheimer's vaccines, and our payer systems are going to choke. But the payer systems are choking right now. Given the costs to the globe, you wonder why the finance ministers aren't here. Why is it that they're not sitting here with the health ministers and saying, this is an economic problem for the growth of the world, economic growth, and sustainability of the way of living in many countries around the world? So we're suggesting that we need to go towards vaccines. Next, it's a systems problem. This slide stunned me when I first saw it. The genomic research in this space has been done largely in European, white, Caucasian populations. Most of the world is not that. So we have to extend our research networks into low and middle income countries, low and middle income populations. Next. So we have made political pledges in 2013, in 2017, in 2019 here in Japan, and again in 2023. Those political commitments have not been adequately and effectively implemented. If one looks back at the 2013 dementia communique at the time, they called for every 2 years countries of the world to report on their dementia investment in research. Didn't happen. They laid out a path to developing a research roadmap and then putting emphasis on where we needed gaps. Didn't happen. They talked about a global fund, a private philanthropic global fund. Didn't happen. So the Davos Alzheimer's Collaborative is trying to pick up the ball. This is a global effort at the Gavi-CEPI level to try and bring together governments, industry, researchers, and patients to do what we promised we would do back in 2013. That is to bring research networks to all of the world, to bring clinical trial systems that are measured by performance and AI empowered, and to bring health systems around the world into conversation about how to adapt new, lower cost, much more accessible means of detecting and diagnosing this disease early so we can introduce disease-modifying therapies before symptoms occur, and that we can eventually get to an AD vaccine. So thank you very much for the opportunity to speak here today.
Thank you, Mr. Bredenbach. Now, this session is open to discussions and questions. Anybody, please?
I have a question for Philip. So since I've started to work in this area, and that was quite a few years ago now, biomarkers have always been around the corner, and then they keep being around the corner, but it doesn't quite happen yet. And my concern is, coming back to what Bart was saying, the kind of link between what happens in discovery and what happens in clinical practice, is that even when something will be available, then how do we translate it in clinical practice? So what is your forecast for when biomarkers may be at a level that we can actually start seeing them applied in clinical practice at the point we are with research today?
Yeah, very good question. Thank you. So I do agree with you that biomarkers have always been around the corner, but they were sort of really around the corner in research. I mean, they have been applied in research. I think many of the things that we see now happening, fortunately, in drug development is thanks to the biomarkers. We are now including the right patients. We have biomarkers to look at the effects. So in research, it has been picked up. And actually, I'm very optimistic that also for clinical practice, the one and only biomarker that is actually achievable to be implemented in clinical practice are the blood-based biomarkers. And if you had asked me 5 years ago, would you ever think that there is a blood-based biomarker for Alzheimer's disease, I would say, no, you're crazy. But it's absolutely possible. So it's actually unimaginable that in a few milliliters of blood, you can detect processes that take place in the brain. And this is achievable to implement this in clinical practice because it's relatively cheap. It should be cheap, actually. And it is sort of for widely use. And the sensitivity and specificities, the accuracies with some of these tests is so high that you can actually think of using it in general practice by including or excluding patients. And that will also limit the costs ultimately, and it will be a very early use in selecting patients for treatment. So I'm a little bit more optimistic than you that the corner will be made and we will get there. But it depends on some of the factors, but not on the biomarkers themselves. They're good enough.
If I might add to that, we have a working group now that's going to complete its work in July on protocol validation of which biomarkers you can use for what stage of the disease, both amyloid and tau markers, as well as protocols for health systems on how to introduce this in primary care practice. We cannot neurologize our way out of this disease. So this is going to happen if, in fact, Leqembi gets to market. We'll start using these this year in terms of blood-based markers. And digital cognitive assessments. We can detect now digital impairment with digital tools. And indeed, our experience has been both in Armenia and in Indiana that 50% of the normal walk-in clinical population has some cognitive impairment. So the degree of cognitive impairment in the population is enormous, and we need ways to basically work through that with health systems on what do you do once you've detected cognitive impairment. How do you then determine whether there's a biological problem that you can address? But these are happening now that we're going to have some disease-modifying remedies.
Okay. Any other questions or comment? Okay. Maybe Mr. Bredenberg, I have a short question. What should be the 7 dementia deliverable for Italy in 2024?
Well, I would return to the work that was done in 2013 and look at that, and by next year develop a roadmap, a research roadmap, a set of commitments by governments to research investments and to collaboration across the various strategic steps that we need to make. So by next year in Italy, we will all meet again, and hopefully we will have a roadmap and a set of commitments that are concrete, and an implementing mechanism, which is what was missed in 2013.
Thank you. Any other question or comment? Okay, maybe I may ask the other panelists for their short comment to one question. What do you think is of the highest priority in a field to accelerate effort to overcome dementia? Maybe Bart first, please.
Yes, I think we need to work much more in parallel. So what we need is more investment. I think that's very clear, and it should be strongly in the basic research, as I said already, and in parallel implementing the new developments, both for the diagnosis and the treatment. But this is only the amyloid, so we need a broader understanding of these disorders, and that's why I think that the basic research becomes really crucial for the next years. So my advice would be first to the UK to really double the investment in the UK Dementia Research Institute, because I think it's underfunded. And then I think that worldwide, every country should do a specific effort like the UK, like the UK and Germany with the DZNE, to create institutes like they did for cancer to propagate the research in these areas.
Thank you, Bart. So the same question to Takeshi.
Yes. So, yeah, we have already discussed seminal importance of biomarkers, especially of blood biomarkers, and I completely echo the opinion of Phil, as that the biomarkers, especially plasma biomarker, may be the game changer. So at this era of ICT, we have implemented so many digital biomarkers that are in the clinical trial, clinical studies, and trial-ready cohort. But we are now realizing that simply the phenotypic biomarkers like the digital markers cannot perfectly predict the underlying pathology. So the combination of those digital biomarkers and biological biomarkers like plasma markers may be vital for the future development and innovation for the new, more effective risk reduction strategy and therapeutics. And then now we believe that it started with the quantitation of A-beta, but now some very sensitive phospho-tau antibody is realizing this in the clinical trial practice. So I have so much hope for the further development. That's my view.
Thank you, Takeshi. All right, time is now over. Let me close this session. We thank all panelists for their excellent presentations and discussions, and also I thank people in floor for active discussion. Thank you very much.
Thank you very much, Dr. Akiyama and the panelists. Thank you very much again. Now, we have two special contents for this today's meeting. Now, there will be a special comment from one is WHO. A message from Director Deborah Kessel, please.
Hello. My name is Deborah Kestel. I'm the director of the Department of Mental Health and Substance Use at the World Health Organization headquarters, and it is a great honor to speak to you during this important Dementia Symposium. I want to thank the Ministry of Health, Labor and Welfare of Japan, as well as our friends at the World Dementia Council and Health and Global Policy Institute for organizing this important event. I would like to thank also the government of Japan for their long-standing support and commitment to advancing the global dementia policy agenda, as well as WHO's dementia program. It was previous high-level meetings such as the G8 Dementia Summit in the UK in 2013, the first ministerial conference on dementia in 2015, or the G20 Health Ministers Declaration under the strong leadership of Japan in 2019 that placed dementia high on the policy and public health agenda. With the adoption of the Global Action Plan on the public health response to dementia in 2017, countries sent a strong signal to tackle dementia collaboratively. While some important progress has been made, I am worried for the 50 million people currently living with dementia and their families. And I'm worried because too few countries still follow the example of Japan and other G7 countries to prioritize dementia by developing comprehensive national policies. Too many people with dementia all over the world continue to lack access to services, and too many carers remain without support. I therefore call on all countries, let's not forget dementia. A challenge of this size cannot be tackled by working in silos. Let's combine forces and learn from each other. My team and I stand ready to work with all of you to address dementia as a global community. Thank you.
Thank you very much. Next, I'd like to introduce a new Japanese movie, Orange Lamp, or A Life with My Alzheimer's Husband. This movie is about a person with dementia and his wife and his family. And this movie will be released soon, first next month. So first, please watch the screen.
実は私、認知症なんです。パパの世話全部してあげる。自分でできることは自分でしてもらうの。それは夫婦で歩む愛しい日々の始まりだった。困ったことがあったら周りの誰かに支えてもらえ。諦めない人生。私だってできることがある。オレンジランプ。どなたでしたっけ？社長です。
Today, Mr. Tomofumi Tanno is here. He is a young leader of the Person with Dementia Japan, and also he is the model for the main character in this film. Please make a comment from Mr. Tanno.
皆さんこんにちは。
Good afternoon, ladies and gentlemen. Well, good morning, ladies and gentlemen. Now we have this movie. Speaking of movies on dementia, they tend to just to focus on symptoms of having dementia. And when you think of those films of dementia, at the end, either the person dies or she or he gets hospitalized. That's usually how it ends in a movie. But in this movie, 10 years have passed. I'm still healthy. I'm okay. And people can learn about this. As I listened to all of your comments, research is so important. That's what I felt. But even if you develop dementia, as long as your surrounding environment is okay, you can still keep smiling. You can still enjoy your life. I want people to know that. And come up with creative ideas, and that's important. It's so important to have that ingenuity. I don't really know what I'm expected to say. You still have more time. You have more time. 10 years ago, when I was 39, I was diagnosed with dementia. I was so confused. My family, they wanted just to make sure that it's not going to progress. So 100 minus 7, and you keep walking and also eat things that are considered to be good on dementia. But in terms of my feelings, I was so depressed, most depressed at the time, I must say. Now, yes, my symptoms of dementia, it's progressing, it's aggravating. I feel that. But environment where you don't give up things, and also environment that you make your own decisions, that's so important. Here in Japan, so many people with dementia, they are now expressing themselves. But still, this environment for management and monitoring, and so, some people, out of their generosity, they just try to do things ahead of what you want to do. Sometimes people just give up everything when they develop dementia. And the family, without family members or caregivers, they become so independent on them, and they just get so confused and so worried. But rather, even if you have some symptoms of dementia, don't give up on your life. Have a certain goal, objective. Be hopeful. There are people who live in that way. I mean, we don't have any evidence at all. But I believe that their aggravation is sort of slowed. That's what I feel as I do activities with my people, with my friends. I hope that there's going to be a research on that as well. Thank you.
Thank you very much, Mr. Tanno. And also, please watch the new Japanese film, Orange Lamp. Thank you again. So, we are going a bit earlier than I expected, but thank you very much. And we would like to move on to the closing remarks. Dr. Lenny Shawcross, Executive Director of World Dementia Council, will give the closing remarks, please.
So, thank you very much. Thank you to MHLW for organising this meeting. I'll just say one practical point and then a reflective point on the conversation that has taken place. The practical one is WDC, along with HGPI, will write up this discussion and the discussion that Philip outlined that took place in March, and the recommendations that we are making. We will share those around the G7 through MHLW, and this will be published ahead of a high-level meeting that is taking place this October in the Netherlands. So that's the practical. The reflective would be, I was at the 2019 G20 summit that took place in Japan a few years ago. And I said there that a lot of in the dementia movement, we kind of present it as, you know, the glass is half full, the glass is half empty. And we've got very used to saying that. And I think you heard a bit of that today. But actually, folks, the glass is a bit more than half full now. Because the story is a story of progress in inclusion and in research. But I'll just kind of emphasize the research point, because with biomarkers and treatments, we are getting to a different point. And science, funded by the taxpayer, is delivering results. And the story going forward is going to be that there is a new challenge for payers and policymakers to get that result to the people who need it. And it is only the payers and policymakers now that can translate the success that has happened over the last 20 or 30 years into something that delivers real benefits to individuals. So at meetings like this, we need to emphasize this key point, because it is new. Research has brought us to a point where there is a new challenge, and that challenge is delivering treatments. It's to give people hope and to give people time. And so I think at the conclusion of this meeting, we have a very important thing to celebrate, which is that success, but a very important challenge we need to start addressing for policymakers and for governments, which is they, and only they, can get that treatment to individuals to make a huge difference to people's lives. So thank you very much for everyone attending, and then let me hand you back.
Lastly, Dr. Kiyoshi Kurokawa, Chairman of Health and Global Policy Institute and Vice Chair of World Dementia Council, will give the closing remarks.
Thank you for coming together, and let's institution to host this thing with our government. That's great. Dementia, how many of you live together with your parents and maybe some member of grandparents together before you go to college? How many of you live together when you're boy and girls with grandchildren? Some. I spent with my one grandparents until I go to the college. That was a normal case. Now I think all of a sudden somebody married, live somewhere. That had become a norm. When that happened? Very recent, only half a century. Many countries, I think you live together with grandchildren as a boy and girl. And so you know what kind of thing is happening. But once you become adult, you become independent, married, and you never lived with parents or grandparents. And that kind of life we live now, right? Why is that? I'm sure there are many people lived 60 and 70, 80s, and some are demented. But that was not the issue. Why is that? And I think we as an animal, top of animal species, we are going to die. You know that. No exception, right? How you want to die? Have you ever thought about it? Because you're usually seeing some of the grandparents dying in that space, not in the hospital. That was only 50 years ago, even sometimes somewhere in the world. That's the life of the new children, adult, together with grandchildren. And they may be quite demented too. So who are providing care now? We are reasonably selected few of the entire world. And we are talking about dementia. That is quite normal, because we live longer. So isn't that we are asking too much? I'm not so sure. So that is the issue. If somebody has to take care of this thing, is a private sector part or whatever the sector have to do something, I think that is a bit of too much of demand, perhaps. If you see when many has some signs here of aging, and you take it as an aging process, and brain is no exception. So when we see somebody with slight, not the dark hair, and whitish Japanese, we know they are aging, and some they may be a bit crazy. So maybe we may be asking too much, or I'm not so sure. At least we have to think about how to make an earlier diagnosis so that we can make certain things as a test or some experiences. But do you know when is a sign of dementia in your life? Because I think according to some statistics, when you're 60 years old in Japan, about 5% are demented. But what was the diagnosis of dementia? In decades, it's doubling, according to Japanese statistics, which is reasonably good. What is the basis of diagnosis of dementia? That's my question. Once you have some repeatable sort of numbering thing of dementia diagnosis, perhaps we can do certain things by testing. This happens in hypertension. John Lara found out hypertension is related to sodium intake in 1960s. Then first effective drug for hypertension was diuretics. So these are the sort of scientific, very recent history, because I was one of the doctors at that time, when diuretics came to Japan. This is a new drug. So we use that, and that kind of thing. So Skin is not the exception. Hair is not exception. So you can guess how old you may be, right? So that's a part of dementia. Brain is no exception. So how to do it is one of the issues. So it's not really rhetoric. This is a lifeline, and we know we are going to die sometime one way or another. So that we are part of animal species. What do? We like to be healthy, all right? So why we have to fund all the caring thing from the government or this or that? This is a part of our life. So it's not a cynical thing, but I think we really have to think about the progress of healthcare and biology and everything. There's no question about this. We are really living in a great time. And this is an Economist 3 years ago, Dementia, 3 pages, and they quoted my name in this one. I'm saying not on biology. Digital technology may go much faster to make something useful for early diagnosis. Thank you, great. Thank you very much.
Thank you very much, everyone. The meeting has been finished just on time. Thank you very much. International coordination is a crucial key, and I believe you are the global leader. Thank you very much, and I hope this today's meeting will be the future point and for the dementia. Thank you very much, everyone.